here. So let's define our cases. What are we actually looking at here? Who are we thinking about here? Well, the first thing to say is that if we're going to be doing some epidemiological research onto mental health, we need to actually standardize the definitions of who are our cases, what are the cases that we're going to be looking at, and these are key to successful research here. This definition of mental health conditions might be for depression, it might be for anxiety, it might be for psychosis, it might be for trauma, it might be for anything like that. But the definitions that you use for your research may differ from the clinical case definitions. You don't have to go to the case definitions in the clinical guidebooks and say, this is what I'm going to be using. You may actually be screening for conditions in populations, and you may have a set of screening questions that you want to use in that population. And so if you do that, make sure it's very clear what is your case definition? What is the standardized definition that you're going to be used to define cases in your particular research? Then you might want to say, well, how are you going to use this to identify cases? And again, you might have active methods. You might be saying, well, we're going to go out into the population and we're going to ask everybody in the population these questions. So you might have some active methods to screen people for depression or anxiety or whatever it is you might have, in which case that would be you'd need to define how you're going to do that. And we'll get on to the sort of like sample selection that you might have for your particular research study. You might then say, well, we're not going to have active methods. We're going to stay in the health center. We're going to stay in the hospital, and we're going to see people who are going to come into the health services for treatment. And then we're going to have that passive method for detection of cases. Now, both are very useful and objective ways of doing it, but you need to describe and say which one you're going to be using before you can do your epidemiological research. The number of cases that we get usually form the numerator in this. In other words, the number of cases is the number on top of our ratio or prevalence that we're going to get. And we'll then be able to measure that disease frequency in our population. Another point that I just want to make here is that in any study, we may have several outcomes. We might be defining cases of depression, we might be defining cases of anxiety, and we might be using several different cases there for that. I think I have here, yes, an example here is to, we might be using the GAD-7 tool to measure anxiety. I'm not sure whether everyone is aware of the GAD-7 tool, but that's a particular set of 7 questions which have been developed and which are validated to measure anxiety. And so people with a cutoff greater than a particular cutoff will be considered to have a measure of anxiety, and people who don't have that measure will be said to be free of anxiety. So we might be using the GAD-7 tool as one of the things, one of the measures that we're having in our study. But then we might also have another study, the same population. We might be using the PHQ-9, which is a different set of 9 questions which are used to measure depression in a population. And so we might have both of these different population measures which we're screening for in the same population. Alternatively, we might have a more clinical looking at people in the hospital. We might have a clinical tool which will measure psychological events within the population. So all of these are valid definitions of cases, and what you need to do is decide which one you want to use in your study. And then we come along to the very matter of what are we actually going to measure? We need to define the number who are at risk. And as I said here, this is usually the denominator here. And that's the population from which the case originated. So if we're saying we've got some cases attending our health center or our hospital, then we'll say the population that is served by that health center or clinic is going to be the population at risk of this particular condition. And they would then be in the calculation if they fulfill the criteria for your definition of your case. Now, a study that defined geographically, we might say the whole of the UK, the whole of one region of a country, or we might then further define our population as being, we're just looking at adults. And in that case, we'll define adults as people aged 18 years or more. And if they're aged 18, they'll be part of our population. If they're not, then they won't be included in our population. We might be looking at women, especially if we're looking at maternal conditions, because men don't have maternal conditions. So we might look at women and see about the mental health conditions that they might have look at the particular prevalence of mental health conditions within a particular set of women who are pregnant or have recently delivered. We might look at particular races or particular ethnic groups, or we might look at other characteristics and define that as the population that we're interested in. And of course, this can be a little bit more complicated than it would be first appeared, because although we might define the denominator as people who come to the hospital from a particular population that they serve, there may be people who come to that hospital who don't belong to that population, who are visitors, who come from further away and who don't appear in the population serviced population of that hospital. And the question then is, do we include them or do we exclude them from our research? Of course, if we're looking at disease frequency, we might just be wanting to describe our cases that come to the population, in which case that's okay to include everybody that we have there. But if we want to get an accurate picture of the frequency and the prevalence of a disease, then we need to know who our numerator has and who our denominator has in the population.